A common question I get is whether you should take GLP-1 agonists to help treat and improve PCOS. That is not necessarily a treatment strategy for polycystic ovary syndrome. Now, with PCOS, there is an association and increased risk of insulin resistance or diabetes. And so in that particular case, it could be appropriate to start a GLP-1 agonist, knowing that you have to discontinue it 2 months before actively trying to conceive. I don't really necessarily jump to GLP-1s right away because there are much safer alternatives in pregnancy. And so even taking a medication like metformin has been shown to overall be really safe in pregnancy. It doesn't have the same level of data as insulin, and we know that insulin is the safest thing to take in pregnancy. So it really depends on the clinical scenario, but in general, I will recommend it to those where it is actually indicated.
For a certain subgroup of patients, even metformin doesn't do it. So as a result, we have to think of other ways. And some of the ways to just help insulin resistance or to combat it is literally to just lose weight. And by losing weight, you can use a medication such as a GLP-1, and a GLP-1 can be an excellent tool for the PCOS patients. But what we warn people all the time is that if GLP-1s are going to be the way that you manage your PCOS, you're talking about a lifelong medication regimen. And unfortunately, insurance companies today don't recognize PCOS as an indication for GLP-1s. Metformin is a generic drug, and metformin may only be pennies per week for administration. GLP-1s can be hundreds of dollars per week. And for many patients, that might be price prohibitive. So it's an amazing tool. And it's definitely one of the tools in our armamentarium of what we like to do to treat some of the most challenging patients. But that treatment sometimes can be both cost effective, and for those patients who are scared of shots, it is an injection every week. So we talk to weight loss specialists all the time about how we can actually build a regimen to treat those challenging patients, those PCOS patients.